because it was outside of the prostate, there's really no way to get around it. You know, because the prostate sort of floats in your pelvis. So that means when the pathologist looked under the microscope, so here's the prostate, you had cancer right at the edge of what was removed. So when we see that, we call that a positive margin. Oh. And you had them in two spots, at the prostate spot and a spot called the ureter. And the ureter enters the bladder, okay, from the kidney. It's like, so if the kidney comes here,
yeah,
the urine goes there, and it enters the bladder.
Yeah.
And you saw how that tumor was all in the base of your bladder. Well, that's right where the ureter goes in.
Yeah.
So what they do is they cut the ureter, and then they take the bottom of the ureter out when they take the bladder out. And so that margin was positive as well. And so sometimes when we see positive margins, especially in somebody who's young and otherwise healthy, we give some extra treatment. You know, just to sort of make certain that it doesn't grow back.
You calling me young?
Yep.
I'll be 70 in October, you know.
Yep.
Okay.
But you're in good shape.
Yeah.
You know, you're in good shape. And you're the one who never drank, never smoked, you don't even drink caffeine, right? That's you.
Well, not never. I quit all these things.
Yeah.
Yeah.
So, so that's what Dr. Belmont and I are going to talk about.
Yeah.
You know, do we want to watch you and see what happens? Or do we want to give you a little radiotherapy? Or do we want to give you a little chemotherapy? Or do we want to do both?
How do you decide that?
It's tricky. It's patient by patient because there are no guidelines for what to do. I mean, one, it's a rare cancer to find in the prostate. We see them, but it's rare.
Yeah.
Two, it's always hard to know with what to do with the cancers, bladder cancer that grows into prostate or prostate cancer that grows into bladder. When they're surgically removed very nicely, as yours was, but there's a little bit at the edge.
Yeah.
That's always a clinical conundrum, we call it. And so that's where we're going to have to do some thinking about that. Sometimes we watch people, you know, and we just watch and wait. If your histology was different, that might make it easier to decide what to do, but where you've got the odd histology, that also makes it a little trickier to decide how to manage you. So we're going to have to do, and we're going to have to do some communicating before we come up with a final treatment decision.
So after I see Belmont?
Yep. Yep.
Okay, you don't know. See, before all this, I was planning on moving to Pennsylvania.
Boy, do you have family there?
Yeah. Mm-hmm. So I told Preston thought, well, do all the stuff I could do here, and maybe look at October, November.
Yeah. Wait a little bit, yeah.
And maybe set up. My hometown is an hour and a half from Pittsburgh and Cleveland, the big cities. You know, he said, well,
you could be, let's give this a little bit. Let's wait until, step by step.
Okay.
Yep. Where are you living now?
Woburn.
Woburn.
Yeah, see, well, I mean, God, if you do chemo, my problem is trying to get it right all the time on chemo and don't know how much.
Yeah. It is hard.
We do.
Okay. Smile.
Oh, I had a smile.
Great.
I wonder what the hell that was.
Camera. All right. Let me make sure the other things in here are correct. Okay. So you're not taking finasteride anymore?
No.
So let's get rid of that.
This is about the third or fourth time somebody's going to get rid of it.
That, you know what? Because it's not so easy to get rid of.
Yeah, it keeps showing up on everybody else's computers, even though it's networked.
It appears to be gone. Do you have any other medicines you take?
Well, I don't know, it's medicine. They gave me prescribed that Colas.
Colace.
Yeah.
Okay.
I'm taking it off and on.
Yeah, that's just for constipation. Okay.
Sometimes I take Tylenol, but
that's fine. And then.
So I'm not taking.
No allergies.
No.
Okay. And really, do you have medical problems other than this?
No. Hope not.
See, you're in good shape.
Yeah, I was driving a truck up until this all started. I was jumping off the darn truck. I was doing okay. Got the building shaking.
Everything okay?
Yeah.
Okay.
We'll see.
Okay. And then, in your family history,
I gotta talk to my sisters on that one.
okay. But not so far as you know.
Yeah.
Okay. All right. And then let's just take a quick look at you. I just want to look and see how you're healing.
Oh no. You have you been over?
No,
Oh.
no, I'm not going to do that, though. I could look at your tummy.
Oh.
No, please.
I got the bag there.
That's okay. We look
You
at these
wanna
all the
lie
time.
down?
Yeah, lie down.
Let's see how that back.
I'm going to throw my camera away.
Yeah.
That's good.
Yep.
Here, pick
Oh.
up one. Now go back. Just give you a little bit more for your head.
Where are the gloves in this? Oh, there. Could you get me too large, though? Oh, you're healing nicely.
Yeah, I can't wait for the swelling to go down.
He really has no medical problems. He's not on
Really?
medications.
Good for you.
Little Colace from time to time, little Tylenol. Doesn't smoke, doesn't drink. There's a truck driver.
I missed my beer.
Do you? It's not good for you. It's all sugar. So it's like alcohol and sugar.
Okay.
Let's see. Nice.
He's perfectly healed.
Yep. Excellent. Okay.
And you got a nice tiny little stone
Yeah.
there too. So
Nice.
Not bad.
Yeah, he does nice work.
Who was it?
Preston. Very nice. Okay, sir. That's all we need to do.
I'm good. You scared the hell out of me earlier.
Don't touch me.
Yeah.
The dreaded rectal exam. I know you're getting out and about, you're sleeping at night, you're eating well.
I can't get to sleep. I have a hell of a time. I sleep on the couch, then I go to the bed. My leg always, when time to go to bed, I get a pain in my leg because I'm stretching it out.
Mm-hmm.
And then when I'm super tired, then I'll fall asleep.
Mhm.
I'm getting like probably 6 hours sleep.
Do you want a sleeping medicine? Nice, not addictive one?
See, I'm staying up late watching the basketball games. So that's midnight. It still takes me an hour or so to fall asleep.
Oh, well, that's too long.
And then I'll wake up 2 hours later,
No.
and I empty the bag, and then I'll fall asleep.
Were you like that before you had all this? Or
No.
were you just, so you think your mind just doesn't want to settle in?
I tell you, I mean, like I said, I'm going to bed after 12 because of the games. I mean, I am tired, but I'll lie down maybe because, I mean, I'm a Cleveland fan. Maybe, I don't know, maybe I'm sad about the game or whatever, but I just can't fall asleep right away.
Yeah. Are you not drinking coffee or anything like that?
No
at
coffee.
night?
Tea in the morning. That's just a cup
That's
of
fine.
decaffeinated.
Yeah, that's fine.
No, he doesn't drink.
Quit drinking 10 years ago. So I'll be doing MRIs shortly, aren't I? So you get,
Probably MRI or PET scan.
yeah. Yeah, I wish you guys had satellites that are closer to me, but you don't. Londonderry, New Hampshire.
Yeah, but you know what? Even when they're satellites, they're not the same.
Same machine. I mean, and then you just fax over. No. Because Winchester Hospital had to go to all their satellites for different scans and colonoscopies and endoscopies. And they were like right around the corner for me.